Okay, so with this section, we get to the end of our presentation. Thank you very much for everybody that has been here throughout the day. And it is reporting and outcomes. Reporting is not fun, but it has to be done, okay? How do we know that we're achieving quality? We need to measure it, and we need to run some reports. So how do we account for quality, measuring quality, importance of data integrity, and reporting tools that we have in HCN? That's what we're going to conclude our presentation with. And this is what we need to keep in mind as we go back to our desk tomorrow. How to account for quality? To assess quality, quality must be measured, which we already know how we're doing. We're checking our workflows, we know our goal, so we know that it's being measured. To measure quality, you need the data. So we're going into our centers, we're making sure that the data that needs to be collected is being collected, correct? And to collect the data, they should be standardized specifications, clear understanding of what data is the one that needs to be collected in order to achieve each one of the goals. We already know, and this is kind of a review going back to what Brian started his presentation with in the morning, that there's already standardized reports in the industry. We have HRSA collecting information from lookalikes, utilizing the Uniform Data System report, okay? We have NCQA collecting information from managed care plans, utilizing HEDIS. We have the Center for Medicare and Medicaid collecting information from accountable care organizations, trying to improve on the cost and the effectiveness of the service for the patient. And we are also, there was also an incentive program that we are all very well aware of, which is, who doesn't know that, isn't it? So we know that quality is being measured. We know we have standard reports out there. We need to keep an eye on poor data quality and attributes. Very important. It seems easy, but if the people are not detail-oriented, the people that you have at the front desk, the people that you have as your clinical support, even the doctors, we're never going to achieve quality. I'm going to give you a very, very easy example of what this entails. Poor data attributes can lead to threats to quality and safety. Very easy example, a bad address. The staff at the front desk doesn't take the time to ask the patient if they changed their address. Then the referral information is sent to their houses, sent to the wrong address. What if it's a referral that needs to be done quickly, that is urgent, that is needed? We're already losing time, correct? Because it's being sent to the wrong address, it needs to be returned, back and forth. So we're already going into threats of quality and safety. Patient staff dissatisfaction, bad addresses. After that, you have all the time that is spent by the staff in the organizations trying to figure out what address is correct, updating addresses. Increase on operational cost, all the money that you're spending on stamps, all the money that you're spending on paper, all the money that you're spending on staff spending time trying to figure out correct addresses, very costly. Less effective decision making. If I don't know what the addresses are, and this one will be duplicate patients, if I don't have the right information, the right patient, how does the doctor going to be able to make effective decisions? Reduce the ability to execute organizational strategies. If I have a large number of duplicate patients, how do I know when I run my reports that the number of patients that I have in my reports is the actual number of patients that I have in the center? So you're reducing the ability to make organizational decisions. And patients are your customers, are our customers, are the center's customers, and they are the ones that have to go through the aggravation of having to call time and time again, trying to figure out where the referral went, try to figure out where the information went, if it went to the wrong address, or sometimes even come to the center when they don't have transportation and when they don't have access to a center, correct? Just because somebody didn't take the time to double check that the address that they have for the patient was correct. For our member centers, we have some tools that are available for them. We have, in Entergy, we have the activity audit log. I'll go over that one. We have some reports in Clear, Practice Analytics, and other public resource reports available. Okay? The activity log. Remember at the beginning when I mentioned to you that some users like to, I don't know why, share user IDs and passwords? Okay. Well, we do have a tool in Entergy that is called, and this is for the administrators. If you go to the Practice Administration, Utilities, Security, and Activity Audit Logs, we have a report in Entergy. Okay. Technical difficulties? No problem with the presenter. Picnic error. Okay, we have a report in Entergy. It's called the Activity Audit Logs. And for a lot of end users, they did not know this. And when we go to the centers, they find out when we do these presentations. Everything that you're doing in the system is being tracked. Everything. When you log in, what system you log in from, what computer did you log in from, at what time did you log in from. This is how a lot of centers are starting to find out that users are accessing information about their family members, or that they're accessing information about VIPs. This report has a lot of information for the administrators, and it's a very, very good tool for those administrators that make use of it. We also have Clear. I love Clear. Some people are not fond of it. I love it. Why? Because of infographics. I love infographics. They're very image directed. You can get a lot of information just by looking at the widgets. And our business, intelligence department, business intelligence department has been working very diligently in creating these dashboards. You have the information there to look at where you are right now in the different reports in obtaining quality. You have the HEDIS dashboards, and as you can see, we have dashboards for CQM, for HEDIS, for meaningful use, for PCMH, and even for UDS. So the information is there for you to review. Yes, you do need access, but you can just ask one of your administrators. The other thing that has, for PCMH, I like this widget in PCMH. If I'm going into a center and I'm going to do a workflow assessment, and I come here and I look at this widget here, I already know that this center is having issues obtaining advanced directives, correct? So when I sit with the front desk, the first thing that I'm going to be looking at, okay, do they have the forms in place? Are they asking the patient for this information? Reports help us focus our attention on where is needed. Okay, so Clear has some good widgets. These ones have become very popular. The patient wait time is per center, and the no-show rate. We also have Practice Analytics, and in here we're just highlighting the dashboards, UDS dashboards. So for a center, you don't have to wait until December to find out how you're doing. We're already we're in June, we're way into the year. It's a good time for the centers to be running these reports and find out how they're doing right this minute and address whatever is not being accomplished. And do some workflow analysis and redesign if needed in order to make sure that the numbers are there. Oops. See, Daisy, it's not technical. Okay. Oh, sorry about that. And finally, we need to keep telling you, as we do our workflow analysis and workflow assessments and redesign, it's an ongoing process. It never stops. One of the examples for doing is SOGI. When SOGI came out last year, 2 new fields in the registration field, 2 new fields that a lot of centers were hesitant on how it was going to be asked, sexual orientation, gender orientation, did I just get them all? Oh, I'm glad you've been paying attention. Okay. I was just testing you. Okay? That was just a test. When that came out, they had to go back to the books and reanalyze their workflow. They need to ask themselves, do we want the front desk to be asking these questions, or do we want the clinical support staff to be asking these questions? Do we need any disclaimers? Some centers have disclaimers already on file. Do we need to add this to our registration forms? So it had to be, they needed to go back to do this process. They needed to plan, do, study, and act over and over again, and we're part of that process for our centers. And with that, we conclude the presentation, and I'm just asking for Brian and Wendy to come and join me and say thank you to all of you for being here part of today. Thank you very much.